I want to thank everybody for coming and welcome you to the 5th Annual C. Everett Koop Distinguished Lecture. The title is Corporate Threats to Children's Health. This is going to be a panel discussion. I want to acknowledge the generous support of the Rockefeller program here at the college, the Norris Cotton Cancer Center, and the Children's Environmental Health and Disease Prevention Research Center, Dartmouth, who entities that combined to make this possible. I noticed that there's a lot of young people in the audience, so I'd like for us all to raise our hand if we've ever heard of C. Everett Koop. Yeah. So everybody my age has heard of C. Everett Koop because he was the Surgeon General during formative periods of our life, but there are many of the younger people that haven't heard of him. And so part of the reason for having this is to remember C. Everett Koop, who was Surgeon General from 82 to 89 in this country. He graduated from Dartmouth in 1937, and then from 46 to 81, he was Surgeon-in-Chief at the Children's Hospital, Philadelphia. Dr. Koop virtually invented pediatric surgery, the idea that children had to be treated differently in the surgical suite than older kids, little kids, compared to older kids and adults. He invented many surgical procedures. He was the first editor of the Pediatric Surgery Journal. And then in 1982 was appointed Surgeon General by Ronald Reagan. He was the first, probably the only Surgeon General to become a household name in this country. And he was a household name a little bit. If anybody's watched the Ken Burns series on Franklin Roosevelt, he was a household name because he was a great educator. He taught us about tobacco, about the tobacco epidemic. He taught us that nicotine was addictive as heroin. And he challenged us to develop a smoke-free society by 2000. No Surgeon General up to then had spoken out as strongly about smoking since 1964 when the Surgeon General report came out. He also taught us about AIDS because the epidemic was developing at the time. And he sent pamphlets to every household in the United States teaching them about safe sex, despite the fact that he was roundly criticized by conservatives for talking about sex as Surgeon General. So he was a really great man, and we commemorate his name and person in this annual event. Joel Bakan, who's one of our discussants, is professor of law at the University of British Columbia. His law degrees from Oxford and Harvard, and he studies corporate practices that undermine health and other aspects of society. He wrote the 2004 book, The Corporation, that was subsequently made into a documentary movie and has been translated into over a dozen languages and distributed all over the world. More recently, in 2011, he published Childhood Under Siege, How Big Business Targets Your Children. So Joel's going to be our first speaker. He's also a really good jazz guitarist. He plays jazz guitar in British Columbia with his wife. If you go to British Columbia, you got to see him. Bruce Lanphear I've known for many, many years. He's a professor of child and family research at the Child and Family Research Institute in British Columbia and at Simon Fraser University. He's an environmental epidemiologist and disease prevention specialist. He's internationally known for his work in lead poisoning. And it was Bruce, that's how I got to know him in the early days when I was studying lead poisoning. But by the time the threshold of concern was down to 10, I thought, well, the problem's done. We don't have to worry about it anymore. And Bruce is the one that taught us that lead exposure, that there's no safe level of lead exposure, that even children who have blood lead levels below 10 are at risk for developmental problems. And that was published in the New England Journal, that particular study. So his current focus is on the pandemic of consumption, and he's going to talk to us about conflicts of interest. So the way it's going to work is Joel is going to come up and tell us about big business targeting children for 15 minutes. I'm going to talk a little bit about unethical corporate marketing practices. Bruce will come up and talk about how corporations undermine science. And Joel will talk about possible solutions. We're going to try to do that all in an hour so that we have plenty of time for discussion after the panel. So without any
I'm
further...
going to come up really quickly since we're trying to do this all in an hour. Well, thank you, Jim, and this really is an honor to be able to honor C. Everett Koop, who I grew up in the United States. I live in Canada now, and as Jim says, he was a household name, a true hero, actually. And I also want to thank the various organizations, the Rockefeller Center, the Cotton Cancer Center, the C. Everett Koop Institute, and the others for inviting me here and for flying me out from Vancouver. I really appreciate it. I'm very happy to be here. Now, my remarks this afternoon are based on a book that I recently published that Jim mentioned, Childhood Under Siege, and those in turn flowed from the earlier book and film that I made called The Corporation. And in that project, I asked the question, if the corporation is a person, which the law recognizes corporations as being their artificial persons, what kind of person is it? And the answer I suggested is that the corporate person, though not necessarily, and this is really important, not necessarily the people within corporations, but the corporate person itself, if it were an actual human person, would likely be diagnosed as a psychopath. Because, and I know that sounds kind of hyperbolic, but it's actually a fairly cool analytical analogy, because when I look as a lawyer, as an attorney, when I look at the legal constitution of the corporation, what comes clear very quickly is that it is legally required always to act in its own self-interest and to have the singular goal of creating wealth for those who constitute it, namely its shareholders. So the question at the heart of my new book is what happens when we unleash this psychopathic institution on those who are most vulnerable among us, namely children. And what I argue is that in a number of different areas, and I'll only be looking at two of them today, there is a common and disturbing pattern of children's interests being sacrificed to corporate strategies of profit and growth. And that's what I think the sort of theme of this whole panel is. Now, every author will tell you that there's a moment, a seminal moment, when some inchoate idea crystallizes into a sense that a book has to be written. And for me, and this latest book on childhood, that came largely because I'm a dad, and I was watching what my kids were up to, and I asked my 11-year-old son, what is it that you and your buddies get up to when you're all sort of huddled around the computer? And this was about 6 years ago, and I'd noticed a migration from the TV to the computer as the sort of entertainment vehicle of choice. And he said, there's this really cool site. It's called, and for the young ones among you, you'll recognize this. It's called addictinggames.com, to which my first response was, they actually call it that? But that was just the least of it. When I went to the site, I found listed among its most popular games a game called Boneless Girl, which has players smash an animated, apparently unconscious, semi-naked woman against various sized spherical objects, squeeze her through impossibly narrow gaps that cause her limp body to be crushed and contorted. Poke and pull this scantily clad babe all over Bubble Land, the teaser exclaims. You'll be amazed by the small spaces she can fit through, and throwing her across the screen never gets old. So this is what my 11-year-old son and his friends were watching. And it's important to note that this game isn't found in some dark corner of the web where kids might accidentally or sneakily stumble upon it. But it's at a site that's aimed specifically at tweens and teens, 10 to 20 million of whom visit it each month. And it's not delivered by some shady internet operator based in Lanphear or wherever, but rather by the world's leading children's entertainment company, Nickelodeon. And I feature Boneless Girl in the book because it is, I believe, endemic of a dominant trend in kids' media and marketing, especially over the last couple of decades, one that has seen marketers become increasingly brazen in their efforts to squeeze profit out of kids' natural emotions, their natural curiosities, and their natural desires. And I thought, as I do in all of my research, I want to hear it from the people who are doing it. So I interviewed a lot of people who make a profession out of marketing to children, and they were quite candid about what they do. They told me in no uncertain terms that their job is to uncover, using psychological evidence, and then manipulate kids' emotional hot buttons and desires. That's what they do when they go to work in the morning. And so whether it's targeting kids' appetites for sugary, salty, high-fat foods, whether it's targeting their love of pets at highly addictive sites like Webkinz and Club Penguin, whether it's exploiting their natural fascinations with violence and horror and sex, or their obsessions with what peers think of them, their insecurities, their forming identities, their desires to be older than they actually are, their tendencies to get obsessively hooked on games and social media. I mean, for parents, for healthcare workers, for really anybody who cares about children, these tendencies, these vulnerabilities of kids are reasons for protection. For marketers, these tendencies and vulnerabilities are resources to be mined for profit. With the aid of calculated strategies, sophisticated techniques, the best psychological and neurological science, the latest technologies, and most importantly, without regard or concern for the consequences to kids or to childhood in general. And these marketers are targeting kids all the time and everywhere, 8 to 10 hours a day. Kids are engaged with commercial media, according to a study done by the Kaiser Institute, on numerous platforms and devices, increasingly interactive, social, mobile. And the problem is not just that they're sort of doing it all the time, but the marketing itself is getting much more, and here I'm quoting from one of the world's leading kid marketers, Martin Lindstrom. He wrote a book called Grandchild to give you a sense of the kind of work he does, and he said himself that this marketing is getting, quote, craftier, savvier, and more sinister. So you've got tactics like deliberately designing food to encourage compulsive eating or addictive eating. You've got the same thing going on in the video game and the online game industry. You've got immersive marketing, peer-to-peer marketing, extreme product placement, child-directed alcohol, tobacco, gambling, firearms marketing, more and more brutal and overtly sexualized material being aimed at younger and younger children. And the evidence suggests this is having ill effects, including some of the evidence that Jim will talk about. So child obesity, it's well known as on the rise. Kids are becoming consumed sometimes in quite harmful ways by online media, by gaming. They're thinking more aggressive thoughts, the literature reveals, and feeling more aggressive feelings and engaging in more aggressive behavior as they play more violent video and online games. Girls especially are suffering from low self-esteem, insecurity, eating disorders, partly as a result, according to a meta-study that was done by the American Psychological Association, partly as a result of an over-sexualized media. I caught up with a guy named James McNeil, who is the, everybody accepts, he's the guru, the sort of founder of kid marketing back in the 1960s. And he's now, 80 years old or something, in retirement. And I asked him, what do you think about what's going on? And he said, it's really bad and we should be worried. There's a quote from him. We should be worried, he said, about the monster that he helped create. And he said, I don't know many people that aren't. I'm not marketing my book here, but there's a more extended treatment of the interview with him in the book, if you're interested. That's not an advertisement, nor a product placement. And we should be worried. Of course we should be worried. And we should be worried about a second area that I want to look at. And that while Jim is really expert in the marketing piece, this is an area that Bruce is expert in. And that's kids' exposure to industrial toxins. And so let me begin with some scary facts. Over the last few decades, the quantity of industrial chemicals produced or imported by US companies increased 75-fold, from 200 billion pounds to 15 trillion pounds. 26,000 new industrial chemicals entered the market during that time, making for a total of 90,000 in circulation. Relatively few of these, as few as 200 of them, according to official estimates, have been tested for safety, while many are known or suspected to be carcinogenic, neurotoxic, or hormone disrupting, and growing numbers of these chemicals in increasing amounts are found not only in the environment, but in children's and infants' bodies, sometimes in several times the amounts that are found in their parents' bodies. In the meantime, and of course the causal connections here are very controversial, but certainly in terms of correlation, childhood asthma, autism, leukemia, brain cancer, certain birth defects, behavioral problems are on the rise. Babies are being born on average a week earlier than they were 30 years ago. Significantly more of them are being born premature. Yet despite all of this, the official line of industry and government is that unless and until exposure to a particular chemical can be shown to cause some kind of tangible harm, we don't need to worry about it, and we don't need to do anything about it. The U.S. Centers for Disease Control and Prevention described it. They said the presence of an environmental chemical in people's blood or urine does not mean that it will cause effects or disease. Small amounts may be of no health consequence, whereas larger amounts may cause adverse health effects. And the problem with this approach is that while it is true that small amount may be of no health consequence, the latest science suggests there's a good chance that small amounts are having some very negative health consequences, particularly for children. The more we look, according to Dr. Leo Trisande, another children's environmental health expert, the more we look, the more we realize that the prenatal period and during childhood and adolescence as well, where so much development of organ systems is occurring, appear to be extremely vulnerable windows for even very exquisitely small doses of chemicals to have profound and permanent lifelong consequences. We are, the humans, in a dangerous and unnatural experiment, is how he describes what's going on, especially with lax regulatory oversight. And it is, he added, unconscionable. Now, as I move towards the end of my time, I have 3 more minutes, I think. It's important to address the idea that many proclaim, that it's really up to parents to protect their children from industry-caused harms, and that they should be the primary. These are really matters of parental choice and responsibility and protection. And there is a grain of truth to that notion. Of course, we as parents should be vigilant in protecting our children. But this is really the central point of my book. Parents can't do it on their own, no matter how informed, diligent, committed they might be. The problems are too vast, they're too unknowable for parents to be expected to address. And this point was really driven home for me when I interviewed Bruce for the book. And I asked him, I said, as a dad, as a father, like forget about the fact that you're one of the world's leading environmental health experts, how do you deal with this with your daughters? And he said, and this was not at all comforting, he said, I feel totally ignorant about most of it. I can't keep up with it, even if the data were out there, but the data's not out there for most of these things. At the end of the day, Bruce said, parents can't be expected to know. They shouldn't be expected to be chemists. Some things, he said, are beyond our control. And I think that's really the issue here, that some things, many things, are beyond the control of parents and individuals, not just in relation to environmental toxins, but in relation to all the different ways that corporations target and harm children in their pursuit of profit. Something needs to be done about this. But, and I'll leave you hanging, before addressing the question about what needs to be done, I will hand the podium over to Bruce and Jim. Thank you very much.
Joel will be back. But in the meantime, I'm going to talk quickly about what I know about marketing practices in children. I want to say, first of all, I don't have any conflicts to report. I don't take any money from any private interest. The money that I take is mainly from the U.S. government. So So I want to start out just by looking at corporate products and preventable mortality in the United States. And if you look at how that works, what you find is that tobacco is the big killer. Cigarette smoking is responsible for over 400,000 deaths a year in the United States. But alcohol is a very important killer, as well as energy-dense food that leads to obesity and diabetes. So those are kind of the three big killers, but there are environmental toxins such as lead that are responsible for a lot of deaths, guns that in this country are responsible for a lot of deaths, and cars that are also responsible for a fair number of deaths. So these are corporate products. These are preventable deaths that they cause. They number in the close to $1 million, in the high hundreds of thousands each year. The corporate products are considered pediatric issues because their use begins during childhood. The behaviors get consolidated during early childhood and adolescence. And what we're talking about is unhealthy eating and excessive TV use that leads to obesity. That starts in early childhood, really starts at birth. Kids have a television in their bedroom for the most part in this country by the time they reach the age of 5. Smoking and drinking, which is an adolescent issue, and actually affects kids during adolescence. Drinking especially is responsible for a lot of injuries and suicides. Shooting, we know that handguns are responsible for most of the shooting injuries to adolescents, and driving as well. So I'm going to now talk about marketing self-regulation, and this is how companies get regulated in the terms of their marketing. For the most part, it's left to the companies in this country. And so the strategy the companies have is they develop weak self-regulatory structures to avoid government controls over their marketing. And then they rely on the fact that no independent people are watching what they're doing to kind of flout their self-regulatory rules. So tobacco and alcohol claim to avoid children. I'm going to talk about tobacco and alcohol first. And then food actively markets to children as young as 2, and I'm going to talk about that second. So for tobacco, we know a lot about company strategies because of the tobacco lawsuits. We have a lot of internal company documents that show what the companies have done with their marketing. Companies don't tell you how they market to children. They don't tell you unless you get their documents, usually through a lawsuit. So what we know from the documents is that tobacco companies always maintained that marketing was designed only to prompt brand switching, but that what they were actually doing was carefully monitoring smoking by teenagers. They saw youth as fundamental to the survival of the tobacco industry because they were replacing adults that died, and that the packaging, product placement, and advertising was designed specifically to appeal to new smokers. When I first started studying marketing, these were the campaigns that were active in the 1990s. There was the Joe Camel campaign that featured a character and was responsible for getting Camel another 10% of the market share of the cigarette market. And then there was the Marlboro Gear campaign that we became aware of when we started seeing the catalog showing up in convenience stores and the gear showing up in the school. I remember going to a junior high school in Williamstown in the mid-1990s to pilot test a study, and there was a kid with a Marlboro hat on, a backpack in the back. It was like having a billboard in the room marketing the company's product. So in 2006, the evidence was compelling enough that Judge Gladys Kessler convicted the major tobacco companies of conspiring to do this. And one of the points that she made was that from the 1950s to the present, tobacco companies using different methods have intentionally marketed cigarettes to young people to recruit replacement smokers that would ensure their future economic viability. Alcohol marketing we know much less about because there haven't been as many lawsuits, but we know that they engage in self-regulation, and you can read their self-regulatory guidelines. If you read the Responsible Practices Code, what you find is that they have guidelines for responsible content. They say that the content of the alcohol marketing should not primarily appeal to individuals below legal purchase age. The key word is primarily. What it means is they don't do things like show Santa Claus in their ads, but they're perfectly capable and allowed to show things that would appeal to a young adult and also to an adolescent. They also say that their materials shouldn't portray alcohol products and drinkers in a responsible manner. I'm not going to, that they should portray alcohol products and drinkers in a responsible manner. I'm going to ask you if you think this is a responsible manner.
One minute we were sitting on the couch just talking about it. And then more and more people kept coming.
It was insane. We were there.
So nobody's watching these ads, right? They're self-regulating. It's actually the Better Business Bureau that regulates the alcohol industry. And if that's not the fox watching the, hen house, I don't know what is. But we only know about it because we started studying the ads. And we found that about 12% of the ads now have this kind of a party theme. I'm going to switch now to food companies because they advertise to children as young as 3 years of age. And they advertise directly on television through channels like Nickelodeon. They give away premiums in the restaurants, and they tie those premiums to movies, and they spend about $1 billion a year doing it. Their self-regulation is also conducted through the Better Business Bureau. And the regulatory guidelines for the food industry say that when you're giving a premium with the product, in the ad you should emphasize the product, not the premium, because children are young and they have trouble distinguishing product from premium. And you're also supposed to emphasize healthy food choices, which in the case of McDonald's, for this ad that I'm going to show you, were apples. That was the healthy food choice that they were going to emphasize in their ad. So here's a Happy Meal commercial, and I'll ask you to think of whether they're emphasizing the food over the premium and whether the apples are prominently displayed.
Causing fun. The power of the red box, sir.
I must have it! Activate disguise generator.
Oh, man.
Perfect. Wait for mother, sir.
Whether you're a hero or not, you can get wickedly tasty food and a super toy from the new DreamWorks movie, Megamind. There's one in your McDonald's Happy Meal.
What? Mega villains aren't allowed to have fun too?
So the final thing I'm going to say about the ethics of marketing to young children is that, from my perspective as a pediatrician, marketing to any child under the age of about 12 is unethical. And it's unethical because children have to be able to think, not only know they're being sold to, but be able to think critically about the message before you should be allowed to market to them. So children under the age of 5, which is part of the target audience, can't reliably distinguish marketing from the television programming. And it's not until age 7 that they can reliably understand that the ad is about selling something. And finally, it's not until at least the age of 10, probably the age of 12, before they can think critically about the fact that these companies are trying to sell them something. Try to sell a broken bike or skateboard to a kid that's 8, and you're sure to be able to do that. You couldn't do that to a kid when they were 18. All right, so I want to do a final set of examples from drug manufacturers. And this hits a little bit closer to home to me because I'm a physician. It's hard to know that some of your peers are being paid to be expert opinion leaders for drugs that you're not sure about the indications that they're being sold for. So the idea behind modern drug development is for the company to develop and test the drug around a narrow indication. And then expand the indication without conducting rigorous testing and promote off-label use of the medication. And to promote widespread off-label use, paying expert opinion leaders to give talks and sending drug dealers who they pull from the ranks of cheerleaders into primary care practices where they get delivered to many, many, many patients. So I'm going to talk about Risperdal, which is an atypical antipsychotic. And I'm going to talk about it in the context. This is kind of I'm telegraphing what this is about, but Johnson & Johnson had to pay more than $2.2 billion to resolve clinical and civil investigations that they misbranded Risperdal and that they marketed it irresponsibly and illegally. So that's one of the biggest settlements that the drug companies have had to pay So I'm going to tell the Risperdal story as much as I can piece it together. And it's mainly from, again, as with the tobacco industry, from lawsuit results that you get this information. So Risperdal is made by Janssen. It's a subsidiary of Johnson & Johnson. It's an atypical antipsychotic. So it was kind of a newer generation of antipsychotics that were thought to be safer. And antipsychotics are drugs that we give people with serious mental illness who are having hallucinations and delusions, and it helps them. It settles them down. They're less likely to have, they're important drugs for people that have serious mental illness. But it's a real narrow indication of use. There's not that many people that have schizophrenia in the United States. So this drug was approved in '94 for the management of hallucinations in schizophrenics. And they first targeted the severe mental illness population and expanded their market from about $200 million a year to about $600 million a year during that time. But in order to expand further, they had to find another market. So what they did was they realized that that elderly patients with dementia often had hallucinations. So they started marketing it for that indication. If you have an elderly patient who's having confusion and hallucinations, try Risperdal for that. And they illegally launched a sales force because they're not legally supposed to market these products for off-label use. This was an off-label use. So they launched the elder care sales force, and later they launched a sales force that was directed at primary care doctors to get them to prescribe this drug for patients with dementia. And during this period of time, people with dementia that got the drug died. All right, so the FDA found out about it, and their relatives got angry, and there was a congressional investigation, and finally a large legal lawsuits in the states that were consolidated into this federal lawsuit. During the same period when Risperdal was being marketed to elderly demented patients, about a quarter of the risperidone prescriptions were being given to children. So what's that story? Well, the FDA approved it for the use in children with schizophrenia and mania. And there was a prominent MGH psychiatrist, Joseph Biederman, who's a major figure in child psychiatry, who was studying the use of Risperdal in bipolar disorder, and also autism spectrum disorder. So these are, again, a set of rare illnesses. There shouldn't have been a lot of prescriptions being prescribed, except they were also promoting off-label use, and that was about 75% of the prescriptions for kids with attentional deficits with disruptive behaviors. These are the kids that have trouble sitting still in the classroom. They're defiant. They have conduct problems. That's where most of the prescriptions were going, and it would have been one thing if it was Claritin, if it was a regular drug, but this stuff has side effects. People gain weight. They get diabetes and hyperglycemia and hyperlipidemia, and it also causes kids to have breast enlargement. So people became upset about the side effects. They sued the drug companies. There was a congressional investigation, and Joe Biederman got caught up into this. And what they found was that he admitted to taking $200,000 from the Johnson & Johnson to study this and to give talks about this, but he'd actually taken during that period about $1.8 million. In addition, Johnson & Johnson had started a pediatric psychiatry research center at Mass General, and even worse, he had promised them that he would give, that the trials would show that the drug would be indicated for other populations, such as preschool children. And finally, with these lawsuits that are coming out, we're getting some insight into what they were doing in terms of the children. They were in 2003. They started marketing to children, bringing popcorn to pediatricians and other people that were providing mental health services to children, trying to get that Risperdal sales up to the 2 billion mark. So in summary, children are a key demographic because that's when they adopt consumption behaviors and brand preferences. Marketing self-regulation doesn't protect children from predatory marketing practices. And the risperidone example shows that even with regulation, like FDA regulation, that it's not a panacea that'll necessarily protect children from harm. So I'm going to give the podium up to Bruce.
So while Jim's finishing that up, 25 years ago when I started to do research, I did it because I thought if we could understand the risk factors or causes of some of the diseases and disabilities that plague us, that kill us, that we could prevent them. I no longer believe that. And I'll tell you a little bit about why science hasn't provided us with those answers that I was looking for. But first, let me just try to make sure, since we're talking about conflicts of interest, I have done work for a number of law firms representing California, state of California, Attorney General's office, industry in Canada that was trying to use a lead-free galvanized wire, but I don't take funding for that kind of work. I have served as a paid consultant to the US EPA on a study that I'm involved with, and to the California Department of Toxic Substance Control, another public health agency, and then I have grants. So Jim talked a lot about how many of the things that are killing us are man-made. Now that's tragic on one hand because we're doing it to ourselves. But there's something very promising about that because it means we can control it. We could prevent a lot of the death and disability that takes our family from us. In 2010, Margaret Chan, who's the World Health Organization Director General, recognized that worldwide, chronic disease deaths surpassed infectious disease deaths. That's the first time it happened. Even in low to middle income countries where we have long worried about infectious disease deaths, chronic disease deaths, diseases of industrialization, have now surpassed diseases that are communicable, like tuberculosis, and so on. And she came out with what I thought was a very pointed and courageous statement, and I'll just read it to you. Many of the risk factors for non-communicable diseases or chronic diseases are amplified by the products and practices of large and economically powerful forces, what Jim just described. Market power readily translates into political power. No PR firms were hired to portray the delivery of medicines for HIV and TB as interference with personal liberties by the nanny state, with WHO depicted as mother superior of all nannies. No lawsuits were filed to stop countries from reducing the risks for child mortality. No research was funded by industry to cast doubt on the causes of maternal mortality. Mosquitoes do not have front groups, and mosquitoes do not have lobbies. But the industries that contribute to the rise of chronic diseases do. When public health policies cross purposes with vested economic interests, we will face opposition, well-orchestrated opposition, and very well-funded opposition. So these aren't all of the ways that corporations can undermine science, but I wanted to focus on these. They can hire academic scientists to represent their views, what David Kessler, who used to be at the FDA, described as rented white coats. They can fund research that favors industry products or shows no harm of industry products. They can attack and discredit scientists and intimidate academia with threats of legal action. And they can lobby, and boy do they lobby in the United States, to restrict or tailor regulatory efforts that might protect children and the rest of us. Rented white coats. Perhaps one of the most egregious examples of this recently was somebody I ran into in a case in California that was suing the paint and pigment industry for the lead hazards that they'd caused in housing, despite the fact that they'd known since the 1930s that this was toxic to children, that children were dying from lead poisoning when used in paint and then gasoline. I read this deposition of Pat Buffler, who previously was the dean of the School of Public Health at UC Berkeley, a wonderfully loved epidemiologist, and I read it, and I was first troubled by one thing. First of all, she was representing the paint and pigment industry, and she had no expertise in lead poisoning. Why would she do that? Why would anybody get up and act as though they knew what was going on if they hadn't studied it? That's not what scientists do. Second thing I was worried about is that she tried to cast doubt. This is one of the most well-used tools by industry, the lawyer representing the state of California asked her, what do you think about evidence implicating lead at extraordinarily low levels, below 10 microgram per deciliter? Oh, some articles say it does and some articles say it doesn't, she said. On the next page of the deposition, they asked the question again. Well, I haven't really been asked to study that. And in fact, since 2003, when that study that Jim showed you on lead poisoning was published, there's been over 24 articles, and I haven't seen one that cast any doubt on those same conclusions. But she was willing to do it, and she was willing to be paid quite handsomely for it, $360,000 for her work in that case. Now, I worked pretty hard in that case. I told you I didn't take any money personally, but I did charge them, and that went to the university for research purposes. She charged 10 times more than I did for the same case. That was the second clue. $360,000 for probably 8 weeks worth of work. Pretty tempting, isn't it? One of the things I also want to just point out, we just had a debate at the International Society for Environmental Epidemiology. She was the past president of that, as well as 2 other epidemiologic societies. We cannot police ourselves, I'll tell you, because I was asked by over a dozen people in this debate, you don't really need to bring up Patricia Stoffer's name, do you? And why wouldn't we? It's one thing if you say, that person over there who works for industry is evil. But what if it's somebody from our own ranks? What happens then is we recognize that we can all be susceptible to that. $360,000, that's a lot of money. And what if my child is sick and I don't have medical care? What if houses cost a lot in the Dartmouth area, don't they? So it's extraordinarily tempting. A pediatric surgeon from the University of Washington fabricated data to advocate for using chemicals as flame retardants. Now, this is something that government got involved with too, as regulation, but he fabricated data to help support the development of those policies, and was paid very handsomely for it, using what oftentimes happens is these front groups. Citizens for Fire Safety. It sounds like something that you might be involved with, right? I'm a citizen. I'm concerned about children being burned, but this was paid for by the trade association that was going to make money from selling this chemical flame retardant. We've just finished a study. It's the 5th of its kind. We've followed a group of pregnant women and now their children out to 5 years of age. A 10-fold increase in this flame retardant, it's called PBDEs, was associated with about a 5 IQ point decrement in their learning ability, and their intellectual ability. That was consistent in 4 of the 5 studies done worldwide. And this gentleman was paid almost $250,000 to help support that. We saw during this past decade what was described as an epidemic of politics in Science magazine. Many science advisory panels were contaminated by the industry. I ended up recognizing after the fact that I'd been kicked off of 3 scientific advisory committees during the Bush administration. Now, President Obama has made some changes in conflict of interest, but even as recently as 2006, it was estimated, even at the National Academy of Science, one of our most revered institutions, it was estimated by a public citizens group that maybe as many as 1 in 5 had a conflict, at least one conflict of interest. So this is still pervasive, and it's something that we have to be constantly on the watch for. There's the other groups. This was the American Council on Science and Health. Wonderful sounding group, isn't it? And except for car seats and tobacco, almost everything else was fine, and we were just getting excited about not much. But when this data were leaked, it was very clear that many of the things that they were advocating as being totally safe, don't worry about it, they were actually receiving several tens of thousands, hundreds of thousands of dollars for. Now, I focused on scientists, and it's easy to vilify individual scientists. There's the front groups. That's not hard to understand. One of the things I also think we need to really think hard about is what is the role of academics and universities? it's oftentimes very difficult to find what's going on, but this is a recent example that was published in the Center for Public Integrity. While black lung disease has surged to highs not seen since the 70s because of increase in coal mining, Johns Hopkins Medical Unit rarely finds black lung when they're evaluating the chests and the workers, doing physical exams. And over $1 million was estimated to come back to Johns Hopkins every year. So while on one hand we can say it was clearly the doctors that were doing this, at some point when the universities are taking that money, accepting that money, they also have to bear some responsibility. And in many institutions across the country, of course, we can see this in the branding of our universities. And on one hand, you have to recognize public funding has been pulled from a lot of the state universities, and the kind of research that's available is drying up. The research funds are drying up. And I can tell you how I was trained in terms of worrying about conflict of interest by my chairman 15 years ago. Go get the money from industry. Any industry. Just get the money. And this was a very well-respected chairman in pediatrics. This has been the movement towards this corporate model of academia that we have to be very worried about. I mentioned that industry can fund research that favors industry products or shows no harm of industry products. These are as close as I get to statistics, but I'll keep it pretty simple. The point, I think, is pretty obvious. In terms of nutrition research, a review of the industry-funded studies versus government-funded studies found that for the industry-funded studies, all of them, 100%, found favorable results to industry, that is to their products, whereas only 63% of industry-funded research found favorable results. Bisphenol A may or may not be, how many people have heard of bisphenol A? Probably from the containers that you buy, they're bisphenol A free, right? Well, bisphenol A was developed as a drug in the 1930s, an estrogenic drug. It was replaced by diethylstilbestrol because it was more potent. Pregnant women took that drug, diethylstilbestrol, and the offspring had considerable problems, from breast cancer to obesity to infertility, spontaneous abortion, because it was an estrogenic drug. Well, bisphenol A was not as powerful, but it still is an estrogenic drug. But it also had this wonderful property. It acts like a sealant. And so you could use it on the insides of drinking bottles and canned food. And I can actually find it in 90% of you right now in the urine. We're constantly exposed to this estrogenic drug. But as Joel pointed out, until there's definitive evidence from animal studies and human studies, the model that we operate with in the United States and Canada to a lesser extent, but still mostly, as opposed to the European Union, is till you prove it's toxic, enjoy it. Now, you can take some comfort, right? Bisphenol A was taken out of the water bottles, but they replaced it, and this is mostly proprietary, trade secret information, in some cases with bisphenol S, which we don't know very much about, but there's some early evidence that suggests it might also be toxic. That's the typical strategy. Even when others have done randomized controlled trials of drugs, what they found is, after taking into account the treatment effect, how effective the drug is, and whether there were side effects, they found that industry-funded studies, for-profit industries, were 5 times more likely to draw conclusions that said, take the drug. It's ready for prime time. So what all this suggests is, maybe the evidence is, maybe industry-funded research isn't really research. It really isn't science. Maybe it's marketing. Marcia Angel, who was the editor, one of the editors for a number of years at the New England Journal, one of the premier medical journals in the country, said it perhaps in a more troubling way. It is simply no longer possible to believe much of the clinical research that is published, or to rely on the judgment of trusted physicians or authoritative medical guidelines. I take no pleasure in this conclusion, which I reached slowly and reluctantly over my 2 decades as an editor of the New England Journal of Medicine. And why she says that has mostly to do with there's so many physicians that are conflicted because they own stock in medicines, in particular medicines, because they receive consulting fees from pharmaceutical companies. It's rampant. Now, it is getting better. The conflict of interest rules that have been instituted over the past decade or so, which include publicizing all of the names of physicians who receive money from these pharmaceutical industries has had some impact, but it's still pervasive. Attack and discredit scientists and intimidate academia with threats of legal action. Perhaps the most well-known is Herb Needleman, who was accused by 2 psychologists who've been funded to do research, among other things, by the lead industry. After 5 years, he was able to clear his name, but if you read and talk to Herb about that experience, the first thing that you remember is he said the University of Pittsburgh left. He had to hire his own lawyer. They wanted to have closed hearings. He had to demand open hearings. And it took 5 years to clear his name, but he was ultimately cleared entirely. Another colleague, also in a lead case, the lead industry lawyers went after him to release the raw data, Kim Dietrich. The University of Cincinnati lawyers basically said, "You're on your own." I decided to take matters into my hand. I called a journalist at Science Magazine. The University of Cincinnati lawyers found out about it, and they basically told Kim Dietrich, "If you talk to those journalists, you're in trouble." So he didn't get quoted, but I did, and as soon as this was published, guess what happened? University lawyers said, "Is there anything we can do for you?" Another case that I was involved with, after about 7 years where the lead industry tried to get our raw data from that study, another study that Jim mentioned, they finally decided to try a FOIA. Now, it's not clear that a FOIA, Freedom of Information, suit is able to be brought against a private citizen or a private corporation, like Children's Hospital. But as soon as this was done, the lawyers from the Children's Hospital went down to my statistician's computer and took the hard drive, and then ultimately released the raw data to the EPA, which released it to the lead industry. Now that's all turned out fine, and there was reason to release that raw data, but I think the point is that we have to be very careful. When you're a scientist doing this work, it may not be that you can expect to be protected. And then let me just end up with a couple more quick slides. Lobbying to restrict or tailor regulatory efforts, and I'll just focus here for a moment on the chemical industry. Virtually everybody knows, at least as much as climate change, that environmental chemicals need to be regulated differently than they are. The way they're regulated right now is the vast majority of them are used, they're grandfathered in, you don't know if they're toxic or not, and then people like me come along and we study children, pregnant women, to find out if they are toxic. Now the problem with that is clear. It might take a generation to figure out this chemical or that chemical is causing ADHD or increasing the risk of ADHD. So the flaw is we're basically using ourselves as part of an experiment. So this increased, if you couldn't see that, from 50 million to 60 million. During that time, that lobbying effort was going on to revise that chemical regulation in Washington, D.C. So what are the things we can do? First, require transparency in industry-funded research. I forgot to mention that dean from the School of California, she didn't disclose the fact that she had received over $2 million from a pesticide company because she sat on the board, and her primary research was studying how pesticides are linked to childhood leukemia. Never disclosed it in her journal articles, never disclosed it to federal agencies, never disclosed it to the School of Public Health. Serious penalties for scientists and universities that fail to disclose conflicts. Revisit nonprofit status of universities. Now that sounds pretty radical, doesn't it? But why do we provide a nonprofit status to universities? Because they're there to serve a public interest. And I think the question is, what if in some cases they're not? Reinstitute public funding for universities. Part of the reason they're going out to these industries is funding is being dried up from the public sector. And finally, of course, to enact campaign reform to limit the impact of big business on policy and legislation. If not, all of what we do is for naught. And I'm just going to end up with a very quick quote by a New Englander. There are 1,000 hacking at the branches of evil to one who is striking at the root. And it's become clear over the past 2 decades, whether you're talking about environmental chemicals, whether you're talking about food industry, whether you're talking about the alcohol industry, the root of the problem is not about blaming people for their lifestyle choices. You follow the root, you're going to end up big business marketing their products to make a profit in a sociopathic manner. Thank you.
Well, so you've been hearing a lot from all three of us, and you're likely thinking by now, okay, we see there's a problem. In fact, there are many problems, but what can we do to solve them? And I'm the one who has been given the task of talking a little bit about that. It's probably the hardest question. It's pretty easy to identify what's wrong. It's pretty hard to figure out, solve it. And I want to address that problem of how we solve it in sort of big picture terms. What I want to do is to try to trace the implications of the fact that we as a society are currently in the midst of dramatic change, problematic change, in my view, in how we think about and what we do about protecting public interests, including children's health, from corporate-caused harms. And I think that was implicit in Jim's piece and in Bruce's piece, the discussion of self-regulation, because more and more corporate self-regulation is being relied upon in place of mandatory legal regulation, a trend that really is profoundly limiting our collective ability as a society to address the kinds of issues that Jim and Bruce and I have talked about. And in fact, as I think was clear from both presentations, mandatory legislation, regulation is notoriously rare. And when it happens, it seems almost unusual. And so a notable exception in 2011, San Francisco enacts a bylaw which effectively makes McDonald's Happy Meals illegal. And similar products, because what they say on the basis of evidence showing that premiums unduly attract kids to unhealthy products, they say we're going to ban the giving away of toys. And not surprisingly, industry and others criticized it. McDonald's spokesperson Dania Proud said, parents tell us it's their right and responsibility, not the government's, to choose what's right for their children. And so I can just imagine a parent coming up and saying, I'll have a Big Mac, and by the way, I think it's my right and responsibility to choose. But anyways, that's what she said. The then mayor of San Francisco, who tried to veto the law unsuccessfully, worried that the law went way too far in inserting government to try to be the decision maker in someone's life as opposed to parents. And so the message was very clear. This law destroyed freedom, choice, and responsibility. And that's the message we hear time and again. It's the corollary to suggesting it's really individuals who have the responsibility to look after their health and parents to look after their children. The corollary is when you legislate, that destroys freedom, responsibility, and choice. But the San Francisco City Council persisted in its belief, which I think is instructive, that the ban, rather than depriving parents freedom, responsibility, and choice, actually promoted those values by helping free parents from the grip of their kids' marketing-stoked appetites, and thereby better enabling them to choose healthier options. And I think that is really the crux of why we regulate and why perhaps we need to regulate more. Now, in the end, McDonald's found a loophole in the law. They realized, hey, if we charge 10 cents for each toy, then we'll be complying with the law and still effectively be giving away toys for free. And that's what they and Burger King and others now do. But despite that loophole, which I think can be easily plugged and should be, San Francisco's law really demonstrates the premise and the promise, I think, of mandatory legal regulation, that by using law to restrict the freedom of companies to target children, parents' freedom to make good parenting choices is expanded. And children's freedom from industrial caused threats to their health and well-being is expanded. But the problem today is that the potential virtues of regulation are being obscured and denied not only by rhetorics of individual and choice and freedom, but also by a growing belief in this country and globally that companies can be trusted to regulate their own behavior. and that mandatory legal regulation is thereby redundant and unnecessary. And so the American Beverage Association recently said, quote, "The public policy debates in the US has moved away from taxes and bans and on to real solutions. Our industry is focused on meaningful solutions that help address the complex issue of obesity." Now, the ABA is correct to some extent that the public debate has, in fact, moved away from mandatory regulation, largely a result of the influence and the lobbying and the public relations and public opinion shaping that industry is involved in. And the ACC, the American Chemical Council, similarly touts its flagship self-regulation program called Responsible Care. While it spends $100 million a year, uses its $100 million a year budget to lobby against state and federal initiatives to bolster restrictions on potentially toxic chemicals. The ACC itself has said, the American Chemical Council has said that it has, quote, it said this in a tax return actually, it has helped defeat, and I'm quoting, helped defeat, amend, or postpone the passage of more than 300 flawed bills dealing with chemicals and plastics in 44 states. And it does this proudly with no regrets. We're an advocacy organization, says one of its spokespersons. That's what we do. We advocate for our members. But the problem is that those members don't include children and their families. They do include major chemical, plastics, petrochemical, and pesticide manufacturers for whom the overarching goal mandated by law is to prioritize their own and their shareholders' interests. And what that means, and this helps explain why self-regulation regimes don't work, what that means is that when those companies, or any companies, voluntarily create and abide by self-regulation norms or join existing self-regulation regimes, they must do so. They have to do so in ways that prioritize and serve their shareholders' interests, not the interests of public health, not the interests of children, which is why inevitably these regimes are weak, incomplete, under-enforced, and routinely breached. And you can look at the Children's Food and Beverage Advertising Initiative. One recent study basically says that even when companies fulfill all of their obligations under that regime, quote, the program as a whole fulfilled little of its promise to significantly improve the nutritional quality of the food advertised to children. And the conclusion of the authors is that self-regulation in this area is more a smokescreen than a solution. The same for the chemical industry's responsible care program. There again, a study finds that participants in that program actually end up emitting more pollution than non-participants. And the authors of that study conclude that is because basically, as Jim pointed out, these self-regulation initiatives are entered to avoid legislative initiatives. So these studies are typical. By way of summary, they basically show that self-regulation sometimes works for some problems, but it's profoundly limited. And when compared to mandatory legal regulation, it just does not cut it. And I think probably the best and most succinct, and I'll stop here because we're short of time, but let me just conclude with this quote from Willem Buter. He's the chief economist for Citigroup. And in the wake of the 2008 financial disaster, which many attributed to the failure of self-regulation in the financial industry, he said this. He said, self-regulation stands in relation to regulation the way self-importance stands in relation to importance and self-righteousness to righteousness. Now, there are many examples. Bruce mentioned the REACH program in Europe. We can look at state initiatives on chemicals. We can look at initiatives in the province of Quebec, in Norway, and Sweden, in the UK on marketing to children. There are many inspiring initiatives. I think that in the end, I agree with Moody et al., writing in the pages of Lancet, who said this. They said, regulation or the threat of government regulation is the only way to change transnational corporations. Therefore, the audience for public health is government and not industry. So in 30 seconds more, what I want to say is that whatever else may be said of governments, they are and remain the only institutions in our society with the necessary authority, legitimacy, and mandate to counter corporate influence, to establish and enforce the kinds of rules and policies we need to protect children's health and well-being from corporate overreaching. And so our job as parents, as citizens, as professionals, our job is to demand that governments do that, and that they do more of that in all of those areas, some of which we've described today, where business as usual has become a root cause of children's ill health. Thank you.
I'm going to moderate a panel discussion now, hoping that there'll be people that have either been inspired or upset enough by the talk to speak up, and we'll try to moderate a discussion about this. Roger. Whoops.
I hate to, first of all, this has been a terrific program. And I want to thank each of the professors. I've been working on this for a while, however, thanks to Dr. Sargent, and Jim's got me started, but it's harder to get me stopped. But the government, it's worse than you've said, because the government is part of the problem. And that's what I've been studying as a government professor. I'll just give you 3 examples. 120 million Americans are drinking water which is treated with a compound called hydrofluorosilicic acid. It's a strong acid that's used to etch metal, and it was a waste product from making weapons-grade uranium in World War II, and the chemist who discovered it was being put in water asked me to help him. It increases rates of violent crime. Oh, there's nothing much about that, yeah. At the same time, I've got asked to look at hepatitis B vaccine, which the government requires infants to be vaccinated with at birth. Turns out there's mercury and arsenic in that, and working with these other people, we've just finished a paper showing that if you combine silicon fluoride and the hepatitis B vaccine, you get more infant mortality. And I've been looking at that. Our infant mortality rate is the highest in the OECD. That is, in the United States, 17 or 18 infants every year die per 10,000 births, and those infants wouldn't die in Europe. And it's something that makes me fairly angry. So all I can say is, I don't think we can rely on the government unless we get very precise stuff like this and really push home. And one reason we can't do that, by the way, is that I've talked to EPA about regulating existing toxins. And Dr. Doa, who's in charge of that, told me, we can't do that. We don't have enough money to look at existing drugs. We can only do new ones.
Thank you. I've got my own microphone here, the bully pulpit. I couldn't agree with you more that government is broken, but I'm not sure in a democracy what our options are. I don't think our options is to throw in our lot with industry for the reasons that I've explained. I think there's no question that government is besieged with undue lobbying, with campaign financing, with undue cozy connections to industry, and we need to fix that. But we are still a democracy, and so to some extent the flaws in government are flaws in our own citizenship. We need to reclaim government. The Occupy movement was talking about occupying Wall Street. We don't need to occupy Wall Street, we need to occupy government. And occupying government is what you're supposed to do in a democracy. In fact, by definition, that's what democratic governance means. It means the people have the power, that they are occupying government. Right now, government is unoccupied by the people and occupied by industry interests. And so I couldn't agree more with you, but in moving forward, what do we do? Do we abandon government, throw in our lot with, we have to do something. and we have to go somewhere. And when I look at our governing structures, they're still putatively democratic. They're still there. We haven't gone over the edge into anti-democracy, but we need to work really hard to reclaim them. So when I say pressure government, work with government, I'm not saying that's easy. And I think part of the problem is the regulation of government itself. We need strong lobbying laws. We need strong campaign financing laws. The project's huge, but I'm not sure what the alternative is.
Joe.
Yeah, the bottom line of the reason people do these is for profits. And I just wonder, are there any sort of things that are profitable by doing good? I mean, I mean that seriously. How can you build those types of things into society where you get these students that come out of Dartmouth out of talk, that end up doing things that actually not just generate profits that do bad things, but profits that do good things too?
Joe?
Just very quickly, I mean, I see profit and I see the corporate form itself as public policy tools. I think the difficulty in our current ways of thinking about profit and corporations is that they're ends in themselves. So profit can be a very powerful incentive for good, as can the corporation can be a very powerful structure for achieving things that we need and things that are good. The problem is that when we treat those things as ends in themselves, and when we forget their public policy tools, we end up in the situation we're in. So that's why public regulation actually acts as the sort of balancer, and the creation of incentives through taxation, through regulation, to try to ensure that profit as an incentive does more good than harm. That the corporate form, which is itself a public policy structure, does more good than harm. But we've sort of reified the ideas of profit and corporations into things that are private and not in fact creations and emanations of public power. Once we understand them as that, then their only justification is to serve positive public policy objectives. But we've really gone astray in our thinking and practices on that.
I think it's really helpful. Joel's book, I'm not marketing Joel's book, but Joel's book on called The Corporation. When I read that book, what I realized, I grew up in an era of corporations, and I never even thought of them as not being entities before a certain time. But in fact, when this country was formed, the ideas about corporations were only just beginning to be put forward. And he makes a very important point in his book that corporations were created by government. They can be regulated by government. They can be told to go away by government. This is all something that has been created by government and can be controlled by government. So I mean that's a hopeful. I think that's a hopeful message.
The other thing I'd add in terms of this idea of profit, and one of the studies that we did, it was a national study, and we estimated that 1 out of 3 cases of ADHD in children could be prevented by reducing lead exposure and tobacco exposure, mom smoking during pregnancy. 1 out of 3. Now that's pretty profound. And what I'd like you to do is think for a moment, what if I had developed a drug or a vaccine that would prevent 1 out of 3 cases of ADHD? Think how fast that company would have gotten picked up by a company. How much money I would have gotten as a university professor. And we got some good academic attention, but not much more than that. And I think the problem with focusing everything on this profit motive and putting people up on pedestals simply because they're billionaires is that we don't make decisions that may impact the next generation of people. Everything's about the next quarter bottom line. And so I think we've got to rethink what are the values that we're trying to aim for? And there's nothing wrong with profit, with incentives, but it's only one part of that picture.
And we have to find a way. You were talking about this yesterday. When you have a rapidly evolving epidemic like Ebola virus, I'm not saying that the Ebola virus epidemic is not important, but it captures public attention in ways that the tobacco epidemic, the death from tobacco epidemic, doesn't capture. That's a chronic disease. It takes years to develop, and when somebody dies from it, it's not it's not entirely obvious that they died as a result of their tobacco use. So I think we have to find a way to emphasize the tobacco epidemic and the deaths due to alcohol and other corporate products in ways, and respond to them in ways that we respond to epidemics like the Ebola virus. Yes.
Two questions. One with the government. I agree with you, Bruce. I've been thinking about this for quite a while about how the chemical regulation and also physical, EMF, for example, as totally inadequate given what we know. I'm not going to get into this, but I wonder whether you can comment on whether the FDA model regulating pharmaceutical companies, which is relatively successful, we can still debate on that, but whether that can be applied regulating chemicals and the physical stuff. Another thing is among our scientists, okay, think about our scientists, you probably experienced too, that in addition to those so-called rented white coats, we have a lot of scientists get into debates totally for the sake of debating and totally forget about what is we are doing for public health. Give you an example. You know that right now the cell phone use, we know that, okay, cell phone, the issue of harmfulness is still debated. It's, you know, based on our very high standard. It's going to take a long time, probably decades to figure out. But what is the harm? Tell people so-called precautionary measure, which is, you know, it doesn't cost anything. It just says, be careful, not to use it. And yes, industry is against it. But to my surprise, many, many scientists out there, I mean, I don't know how many are bored, but let's say they are not, just arguing for the arguing's sake, forget about what is the fundamental, what we are doing here for public health? What is wrong with this message? Yeah. Why are you arguing? I mean, they're scientifically, they probably disagree on the harmfulness. I mean, how can we change in the scientific community? Like ISEE, how can we, I mean, most people in ISEE probably tune into this message, but still we sometimes argue for argument's sake only, instead of thinking about the big picture of public health.
Right. So what that brings to mind, which you know very well, is this idea that there's a couple different ways to think about protecting the public. One would be very much like, well, in the last century, before the thalidomide epidemic, which many of you may not know about, but thalidomide was a drug taken during pregnancy, and it was taken during a very specific time, led to children not developing their limbs. And it was very obvious, you couldn't ignore it. That was when regulations for drugs started, early 1960s. Before then, for 5 decades, there were a number of people arguing, we've got to regulate these drugs. They're killing people. They're not necessarily efficacious. They're not working as they were marketed to work. It took a crisis like that, the thalidomide epidemic. And I think that is an apt example of what that regulation recognizes. Yes, drugs have the potential to be beneficial, but we also know they have the potential to be toxic. And the only way to deal with that is to shift the framework that we operate from now. The framework that we operate out of right now, which was largely driven by industry, is until you prove definitively time and again in animal studies, in laboratory studies, and in people that this chemical is toxic, that it causes this or causes that, we have no right to ask industry to take it off the market. It may take decades. It may take, well, in 1909, one of my heroes said, lead poisoning prevention is easy. Just don't use lead-based paint where children play. 1909, of course, we used it till the 1970s. So this other framework, that's the framework that we operate out of now. And it's a very difficult position for scientists to be in. If we operate out of that framework, we operate by saying, until we have this much evidence, we as scientists can't say this causes that, or we don't even say cause, this is a risk factor for that. The way to flip it around, and this is more what the European Union has done, is they say, look, we recognize, well, actually this is what they said, we make 30% of all environmental chemicals used worldwide, they said, and we want to stay competitive. But we also recognize that these chemicals have the potential to be toxic. And so what they did is they put the burden on industry to say, you prove that these chemicals are safe if they're used in high productions, over 1 million pounds per year. You prove that these are safe before we allow you to continue to market them. Same time, Bush said, we don't want to do anything, Bush 2, We don't want to do anything that would harm industry, period. So we have a choice. We can use that existing framework, which really does hand tie a scientist from saying things, or we could change it and take more of a precautionary approach, make sure that the products are safe before they're marketed.
And I think part of the precautionary approach is not to necessarily require a causal standard.
Yes.
For restricting use of a product or restricting advertising, because the companies always are going to require a causal standard, which means multiple studies, animals, the whole business that you were talking about. Yeah.
So what about the unintended consequences when government tries to do good? 30 years ago, we recognized that women who took a multivitamin containing folic acid had fewer babies with selected types of birth defects. So as of 1998, folic acid, which is a synthetic compound, was put in grains and cereals and other foods mandatorily in the United States, and now 72 other nations have followed. And it was folic acid, not 5-methylfolate, which is a compound that the cells really want, which is held by a single patent holder, which would make that company really, really rich. And now, decades later, we've lowered the rate of some selected birth defects, but we're dealing with the unintended consequences that folic acid makes cells divide, makes cells really happy, makes cancer cells really, really happy. And we may be inducing thousands of cases of cancer. And folic acid has a transgenerational effect on methylation. So 2 generations from now, we don't know what the consequences are, but that ship has sailed. We've launched it.
I think one of the reasons corporate activities have such large unintended consequences is because their actions are really big, right? And so anytime you take a big action, you have to take the risk that there are going to be unintended consequences. And I'm not sure how to avoid that, except to take the best action that you can and watch for unintended consequences and change your direction if that happens. But I think if we worry too much about unintended consequences, we won't do anything. I mean, there's always going to be unintended consequences for a big action. The question is, are they going to be, big unintended consequences, like highly prevalent and deaths, or are they going to be? And I don't think we can know, right? And sometimes, right?
In the food supply.
I understand. On the other hand, if we're seeing fewer kids with meningomyelocele, that's a really big deal. I mean,
400 a year in the United States. Balance that off of, what we don't know in the next generation.
I mean, you can add fluoride to that list. That's another, and
the same kind of thing.
The same kind of thing, and I guess what I would say, I mean, governance is a messy and the only thing you can do is, Winston Churchill, I think, said, I don't know, democracy's the best, but it's not perfect. All that kind of stuff. I agree with Jim. We can't avoid problems from things that we do. What we can do is try to create our institutions and organizations so that they operate on the best knowledge possible and with the best objectives possible, i.e., good science and making decisions in the public interest. There are going to be screw-ups, and there are going to be big screw-ups. One of them maybe you could say is building a highway system in the United States and promoting, car travel and all of that. I mean, and now we have global warming. I mean, so but that's why we have a democracy. What we need to do, I mean, following from Bruce's presentation, is we need to ensure that the information that regulators base their decisions on is as good as it can possibly be. And it isn't right now because it's infected and influenced unduly by industry. And then we need to ensure that we have mechanisms, agencies and legislators and executive branches of government that have checks and balances, that are appropriately responsive to local and national communities. It becomes a question of how can we design the best possible governance structures we can. right now we're, if the best is up here, we're way down here on both of those scores. Even when we're way up here, there are going to be screw-ups. That's...
So regulation is really a right and proper function, but there is another way, I think, that does get around the causal requirement as well, which is civil litigation. And there are very courageous law firms that are carrying this fight forward, especially for harm that's already been done. I'm thinking specifically of the atrazine judgment against Syngenta last year. Syngenta was forced to remove atrazine from the water supplies of over 1,000 municipal water districts in the Midwest. And so I think the other approach to this is to be diligent in our efforts to punish corporations that act irresponsibly.
Well, as the only lawyer on the panel, I feel obliged to address that. I couldn't agree more that civil litigation has done has had some very important effects on public policy. And basically what civil litigation does is it privatizes regulation. It effectively says that private individuals will sue each other rather than having a public body exercise its authority. The disadvantage of civil litigation is it's uncoordinated. In other words, and it's also driven by whether or not a particular issue will meet all of the various requirements that a successful litigation will meet in terms of proof and causation and all of that, and whether the lawyers who are taking 30% on a contingency basis stand to make enough money and not risk losing too much. So when you put all those factors together, the thing that drives civil litigation is never we have a public interest that needs to be addressed and remedied. Rather, it's lawyers saying, should I take a risk to try to get 30% of a huge settlement? And those two things don't always overlap. So you end up with a fairly uncoordinated, unengineered response to public interest problems. And one that's driven by incentives that may or may not map onto what needs to be done and in what priority. Now that's a very simplistic answer to a question that has generated tons of literature, and there's a lot written on it. And coming from Canada, we don't rely on litigation at all. We don't have the big rewards, and we tend to rely on regulation more. So if we're confessing our conflicts and biases, mine is that I'm Canadian. So.
I just want to, there's a lot of young persons on this side of the room. I want to know if there's anybody over there who wants to speak up. Yeah.
So one of the kind of, I guess, almost a running gag of this panel discussion so far is the book, the corporation. And you're always saying this isn't product placement. And that leads me to think about the fact that there's a very fine line in a lot of situations between what's product placement and what isn't. Whether like junk food portrayal in television is based on relatability to a teenage life or trying to propagate a lot of those same lifestyle choices. Or whether that book is for further education or to promote sales, or whether this funding for the scientific study is for enlightenment as to this issue or to promote a regional or industry interest. And so my question is, in light of all that, how do we navigate all of these murky questions of self-interest and, from a regulatory point of view, create that fine line to define what is this, this unethical self-interest and what is a corporation naturally doing what a corporation does?
And you're saying specifically with respect to marketing, product placement marketing?
In general, because it seems that this question extends to the question of funding, to the question of creating regulation, even to lobbying. And so I wanted to know what your thoughts were on
that. It gets back to the answer to the gentleman over here that we can never create perfect governance structures. We can only sort of strive to ensure that individual self-interest, which, needless to say, is always a part of the incentives for our acting. I wrote the book, The Corporation, because I was interested in the issues, but I don't rip up the royalty checks when they come. So And you know, we make salaries doing what we do, and we like the prestige and the collegial when we publish our studies and all of that. So we can't escape self-interest. But I think what we have to ask in these situations, or corporate situations, or product placement situations, is that self-interest crossing a line where it's causing harm, where it's deceitful, where it's not serving any positive collective goals, and in fact, it's promoting negative outcomes. But having said that, in general terms, we're going to debate in every case where exactly that line is. That's why, again, we have governance structures that are democratic and where we want to be informed by the best information we can. That's the best as human beings I think we can do in terms of trying to figure out how to exist collectively without destroying our collective existence and harming individuals.
In terms of product placement specifically as an advertising medium, it's increasingly being used so products are creating whole shows around the product, and I think that the concern about that is that it's not necessarily viewed as an advertisement. When you see the product placement in the context of the story or the show, you don't bring the same kind of skepticism to that pitch that you would to an advertisement that you might, mute or something like that because you don't want to hear it. You have to see it because it's part of the story. And if you don't think specifically about the fact that it's a product placement, it's going to affect how you think about the product. And so the question is it okay to embed marketing into people's daily lives so that they don't recognize that it's marketing and perhaps are more responsive to it? I think that's the really important ethical question about it.